So we have a very stringent set of criteria that we use. So we screen donors for infectious diseases in their stool, in their blood. We ask detailed questions about, risky behaviors, travel history, and then of course we ask that the donors not have any GI conditions of their own, including irritable bowel syndrome. We have a weight requirement, and then we ask questions about, other or autoimmune conditions.
Right.
And so, in general, we want, donors to be more or less completely healthy, no infectious diseases, no risky behavior or travel. Initially, patients were limited more or less to identifying their own donors, and so we would screen their donors. But now we have access to stored stool through a company called Open Biome. So this is a nonprofit company where they've organized healthy donors to collect their stool. The stool is screened as rigorously as we would screen it, and the material's filtered and frozen and then shipped to us. So initially, the FDA was not regulating fecal transplants, and more recently, within I believe the past year, they've entered into the area, and they initially called fecal transplants, or they still do. They consider it a biologic therapy, and requiring anybody who uses that therapy to have an investigational new drug application. And of course, this is paperwork that pharmaceutical companies are familiar with, but not clinicians.
Sure.
And so it was a huge paperwork burden, and in essence stopped fecal transplants in the US for some time. And there was a meeting at the NIH, where there were scientists and even a patient who came, to discuss how we could use this life-saving therapy where we didn't really have other options in a way that the FDA was comfortable with. And so right now the FDA has said that if the indication is for C. difficile, then they will exercise enforcement discretion, but otherwise other indications will require the IND paperwork. Currently we are only performing fecal transplants for C. difficile. Otherwise, because we don't have the resources to do the IND paperwork at this time. There are some places where they are looking at fecal transplants for other indications such as inflammatory bowel disease, so ulcerative colitis and Crohn's disease. And those transplants are being done in a research protocol, so under study conditions. And the early data for other indications has not been as clear-cut as it has been for C. diff. So in C. diff, it's an overwhelmingly effective therapy. For other indications, it may also potentially be useful, but the data are not as clear.